Hi, everybody. It's Dr. Linda. I'm just waiting to see Dr. Levitin coming in. It'll be when he speaks, correct? So hold tight. I'm just trying to pull it up on my phone here, Emily, so that I can see the questions coming in. I'm not seeing anything like here, like it's not live on here. Well, it's not showing yet. There you go. There we are.
Yeah,
Okay. So hi, everybody. It's Dr. Linda, the Vascular Birthmarks Foundation. Very excited to be here for our end of the year Zoom session. We are here today with world-renowned vascular anomalies expert, Dr. Gregory Levitin of the Vascular Birthmark Institute.
No, Vascular Birthmark Center.
Vascular Birthmark Center. There's too many. There's Foundation, Institute Center, Vascular Birthmark Center of not only New York City, but also Los Angeles. So he's bi-coastal. Thank you very much, Dr. Levitin, for joining us today from your office in Manhattan.
My pleasure. Thanks for having me today.
Yep. So we already have a lot of people saying hi to you. Krista Hediger, and Tara Nesbitt, Dr. Khalil from Sao Paulo is on saying hi. Lindsay Kragar is watching, Daniel Sacco. So everybody, you have a expert here that will take your questions. Someone from India, Batul, wrote into us, Dr. Levitin. She had to go to bed because it was midnight, and she wanted to know if people with Klippel-Trenaunay syndrome should be worried about COVID, or are they just an irregular risk, or should she be more diligent about quarantine? She's not on any medication, but she does have KTS.
Yeah, so KTS is a condition of dilated veins and lymphatics in an affected extremity. And the main risk for that kind of person is actually blood clots. And we know from COVID studies that COVID infections increase the likelihood of blood clots. In fact, that's, unfortunately in some of the most severe cases and patients who have died, autopsies have shown, blood clots disseminate throughout the body. And now they treat much more aggressively with blood thinners to prevent that. So if you have a patient who's already predisposed to the risk of blood clots, I'd say that's probably the main risk to be concerned about. So if you have severe COVID symptoms, you should definitely be presenting yourself to a hospital setting and certainly make them aware of your increased risk for blood clots.
Thank you very much. So Paulina is watching, and Nalim Raja, Olivia Higgins. So hi, everybody. We have quite a few joining us right now. And for those of you coming in for our COVID clinic, the VBF COVID clinic on Saturday, Dr. Levitin will be there to see patients. We are doing COVID testing. We are handing out these great, I can show you our VBF COVID masks that have Dr. Geronimus's logo with the VBF logo. So everybody who comes will get one of those, in addition to getting a COVID rapid test. So we're doing our triple due diligence. So we're ready to take your questions. I see a lot of you are on right now, and Dr. Levitin's very happy to answer your questions. I know things have been back and forth where a lot of you have been concerned about missing laser treatments and appointments with your vascular anomalies expert. And here are the questions coming in. Okay, and so while Dr. Levitin is on right now is a good time for you to ask your questions about what may happen from missing these appointments. Hello, Lagia Isabel. She's saying hi to both of us. Hi, everybody. Let's start having some questions come in for Dr. Levitin. Again, he will be at our clinic at Dr. Geronimus's office on 34th Street, 317 East 34th Street on Saturday. We have a clinic from 8 a.m. until 1 p.m. with free laser and also free consultations with our experts like Dr. Levitin, Dr. Weiner.
And Dr. Linda, I would just echo exactly what you said is, people who have laser treatments and people who've had laser treatments in the past, We now know in a COVID setting that these are not dangerous procedures to perform in the office setting. They do not create aerosols, so we are using just regular face mask and protection for staff and patients. And we find that, again, that patients are actually quite relieved to get back onto their treatments. And we're actually, picking up where we left off, making progress, getting these babies in the first few weeks of life and making a difference. So I know I speak for all of us who, treat vascular anomalies, is that, since the summer, we've all instituted protocols to create a safe office space for both our patients, our staff, and ourselves. And I would say I have no reservations whatsoever for asking people to come into the office setting. And for the last 4 months now, we've been operating at the hospital. We do a slightly reduced schedule of cases so that we allow for room turnovers, cleaning. But all our patients are tested prior to coming to the hospital for COVID as well. Staff are tested on a regular basis. So I could say in the last 6 months, we've had no exposure or risk of COVID in our work environments with these precautions in place.
That's excellent. Thank you very much for that. We have some questions coming in. The first one from Tara Nesbitt. She wants to know if it's common to have a second lip debulking procedure after many years due to continuous regrowth.
So I think this is a port wine stain question. And the short answer, unfortunately, is yes. What we aim to do each and every time is restore the lip or any part of the face that's been overgrown into a normal shape and contour to achieve that normal function. And particularly with the lips, that's oral competence, the ability to close your mouth with chewing and talking, to avoid drooling, and also to avoid the excessive length that often occurs, particularly in the lower lip. And while we are quite successful at that, we also know that hormonal changes, whether that be adolescent puberty or women with pregnancy, or even for both men and women, as they go through middle age and whatnot, things that have been good for 5, 10, or even 15 or 20 years can regrow. And a lot of us, have seen this, who follow our patients over 15 or 20 years. You think you got it just right, and then 10 years later, they come back knocking on your door. So the short answer is yes, especially the lips seem to have a lot more of overgrowth syndrome, as does any area that seems to have sebaceous skin or salivary gland growth. And those are just areas that hypertrophy or grow over time. And but the fortunate thing is I'm able to use the same incisions from the last time, meaning that we don't make new incisions, but we go back to the same areas we treated before. And again, measure twice, cutting once, we restore these back to normal shape, normal contour, and normal function.
Thank you. And for those of you wanting to submit photos to Dr. Levitin, it's birthmark.org/Dr. Levitin, Levitin. The next question is from Jenna Lynn. She says, hello to both of you. My son is already a patient of Dr. Levitin and is still in the treatment process. Due to COVID, we have not been able to travel to New York City, and now my son is having feeding issues at school. His lip has gotten worse, but he still eats at home. But could this be why he is having issues? So the name is Jenna Lynn, Lynn. I'm not sure what her son's name is.
Yep.
But she said that he is a patient of yours and that due to COVID, they haven't been able to get to you.
So I always really ask her to send me updated photos to see, so I can kind of measure, see it compared to the last time that we discussed. But, that's the thing about the COVID, I'd say about half my practice travels from out of state. And so we have a very strict protocol for our patients who are either quarantining before or after their travel or tested before and after their arrival. And so with 2 negative tests, we're able to bring patients into the operating room. So again, depending upon what particular area, again, international is a little different, but again, from interstate travel, we are able to get a lot of our patients in. A lot of our patients have to just be tested an extra time or two to create a negative window. And then we can perform any surgery or laser treatments that are necessary. So please send me back new photos, maybe describe a little bit more detail. I'm happy to give you some more specific advice.
And one thing, Dr. Levitin, a lot of the families, even the ones coming Saturday, they couldn't even get COVID tests from their state because they're only giving them for people symptomatic.
Right.
So Dr. Weiner is going to order the COVID test for the patients that can't get it done. Would you be able to, like people who come and can't get one, would you be able to get them a COVID test beforehand or?
For your conference?
No, for your patients, like
Oh yeah. So
one
for my patients, I'll just give it. Let me get like, what does that mean? You can do treatment. So my patients who come in for surgery are scheduled typically on a Tuesday. So they actually have to arrive in the city prior to that. So they come in usually on Saturday or Sunday. On Sunday, we do a test at the hospital. Our results come back within 24 hours. So, and then they see me usually for a pre-op visit on Monday, but we have a known negative test on that Sunday. And depending on where they come from, within that 3-day or 4-day period, they have to have been tested one additional time before they left. And then we usually recommend that they quarantine for that 10-day period prior to leaving, so that we know for sure that those 2 tests create a negative window for their procedure. And even for patients who come from a hotspot, we have a second protocol, which is the end of day protocol, which means that we do strict PPE exposure risk to our staff, but we can actually bring even some patients on an urgent basis into the operating room. We just have to close that operating room for 12 hours for strict quarantine and cleaning afterwards. And so again, it all depends upon the nature of the case. But again, routinely, we were able to bring patients in 2 days before the procedure, test them, establish a second negative test prior to their surgery, and then they can leave the next day.
Thank you. So we have a lot of questions coming in. Jody wants to know, have you noticed any major consequences with children who have had to miss any laser treatments due to COVID, such as increase in hypertrophy or blebs? Or is that something that is more likely to only occur in adult patients?
So again, hypertrophy or blebs is a port wine stain condition where untreated or left alone, port wine stains can grow or have overgrowth of the overlying soft tissues of the skin and the fat. Typically, this is associated with adolescent growth spurts or hormonal growth during puberty, or even later in life in the 20s and 30s. But for a few months of missing a laser, that's not the kind of thing that puts you at risk for that. These things are usually measured over months and years. So part of a regimen of treating with lasers to try to prevent or slow that progression. Sometimes we're able to prevent it from happening. Sometimes, despite our best efforts, it's going to happen anyway because of the hormonal changes that occur in about 15% of port wine stains. But during this COVID period, we are usually in a maintenance period for these children. And so again, if we have to skip a treatment or 2 during this year, we're certainly going to catch up next year and try to get ideally that 4 to 5 treatments a year for early treatment, maintaining treatments 2 or 3 times a year for adolescents. And then again, depending upon how things progress over time. But I wouldn't go to bed worried about, oh, I'm going to miss a treatment, I'm going to get blebs now because I missed my treatment this month or even this quarter. These are things that can certainly be picked up when time is safe to come back for treatment.
Thank you. Linda Wheeler wants to know, at what age would you recommend doing laser for a child with a bearded segmental hemangioma? She is currently 10 months old, on propranolol at 3 milligrams per kilo a day, and her last ulceration was 6 weeks ago. So like, when would you start lasering?
Yeah, so a beard distribution implies that it's around the chin and the cheeks of a hemangioma. It's absolutely called a segmental, and propranolol is absolutely the treatment of choice to get started on as soon as possible. But a lot of us, as specialists have, in vascular birthmarks recognize, and I think Dr. Stuart Nelson and Dr. Roy Geronimus have actually shown in publications that propranolol plus laser simultaneously is actually more effective and resolves it much quicker than if you did propranolol and then laser. Now, it doesn't mean you can't do the laser, but sometimes it's so much more beneficial if you can do less treatment and less time on medications and laser. So having said that, if you are a new patient, I start laser on 4 weeks of life, if not sooner. I start propranolol on 5 weeks of life or as soon as possible. And I continue propranolol and laser through the first year of life for these large segmental hemangiomas. In this case, someone did the right thing with propranolol, but it's never too late, and the sooner the better to start with laser. So I would start now, but a large beard distribution implies there's a large surface area. So for those patients, I typically do this in the operating room with a little gas anesthesia. And again, this is to be safe for the patient, also for the pain control for such a large area. And if it's less than that, meaning if it's not such large, you can even try and do this in the office setting. But again, I would prefer to do in the operating room to get a very precise treatment. And this will probably take 3 to 5 treatments, it sounds like, at this point.
Thank you very much. And she can reach you, as we mentioned, at birthmark.org/Dr. Levitin. We'll be publishing that in the string here so people can go back and see it. One of the VBF staff that are on can publish that. So Patty May has a question. Well, she says her daughter is 34 months old. I'm not quite sure what, well, maybe 3 years old, and has a hemangioma on her face. She has been on hemangiol since 2 months old. It is no longer red, just pink veins, but there is still elevation of the hemangioma. Should I look into laser? I have heard that it does not help with a little raised area.
So 34 months is just shy of 3 years of age, as you suggested. And my eyebrows raised because unfortunately for propranolol, longer is not better. We discovered that, the first year of life is the most proliferative stage, reflective of the most proliferating stage of hemangiomas, which is when propranolol is most effective, can be effective into the second year of life up to 18 months, but certainly by 18, 24 months, most of us do not treat with propranolol after that. As we just don't see much difference or change. Now, there are a few exceptions of rebound growth, and we can put that off as exceptions, but by and large, that first year of life is really the role for propranolol. So the first thing I would say is I just think that this child should wean off of propranolol and see what the net effect on that hemangioma is. Now, if there's a raised or excessive amount of tissue, well, this is what's commonly known as left behind tissue, or the involutionary phase of hemangiomas, where not all hemangiomas go away. They do get lighter, the color goes away, they do get softer, but they often leave a residue of fibrofatty tissue. And of course, that's where, as both laser specialists and surgeons, we look for is what kind of role can we play to try to restore this back to normal. Now, laser, as this questioner asked, only treats the surface area. So sometimes you have to look at other types of procedures to remove the bulky fat or even some of the excess of tissue with either surgery or a small debulking procedure. And again, if you want to share some photos online, I'm happy to review those through the links that Dr. Linda is going to provide for us.
Thank you. So Sema has a question. She said her daughter usually gets 4+ laser treatments in a year. This year, she had only one because of COVID and no additional. She's almost 5 years old. How is this going to affect her port wine stain?
So again, I will reflect and say, we have to be safety first. So if there's any risk of transmission of COVID, you certainly want to use your best judgment to stay safe, do what's best for yourself, for your family. And again, if you should communicate with your doctor's office. Most offices have a strict protocol that we bring in safe, non-COVID patients. And when we feel that we have a safe working environment, we can bring these patients back, whether it be the office or the operating room, so that if you feel comfortable, we feel comfortable. And so I think that's what I would encourage you to do, is to communicate with your doctor and talk about that. Because I think maybe the first few months we all took a break, to kind of figure out how this was going to work. But for the last few months, we've all been working quite effectively, quite efficiently, and quite safely. So I would encourage you to go back for treatment, because yes, adolescence is a time where you want to stay ahead of this, not just maintain it, but try to reverse the growth. If left untreated over time, not over a month or two, but over 6 to 12 months, you can lose some of the progress, but you can always go back with more laser in 2021 and pick back up where you left off and get back to where you were.
Thank you. So Ezra writes, her 6-month-old daughter has a port wine on her left chest, left back, and full arm. Is there any effect to her heart? Would laser treatment work on the chest, and is it safe?
So this sounds like a quite extensive port wine stain, and extremities are very hard to treat effectively, particularly ones that are confluent or have a sleeve-like quality where it's very diffuse. The type of port wine stains that have irregular margins or in small patches tend to respond the best. Again, this would be a case where I'd like to see some photos to get a better sense, but realistically, the more extensive, type of sleeve or profuse port wine stains, you can make them lighter, but they don't always go away like some of our, facial segmental port wine stains do. And so we just got to be realistic, talk about what our goals are, our expectations, talk about other types of cover-ups, which include, strategic clothing, sleeves, or even something called microskin, which we are, have several centers in the United States that specialize in this. And I think it's just, again, it's about communication and expectations, and we can certainly talk more about that.
Do you ever do a test spot? I was just curious, like, do you offer that?
So the first thing I tell people is you don't know until you try. By setting expectations, I say is let's try 2 or 3 treatments, because you may not notice in a single setting, but if you commit to at least 2 or 3 treatments and take good photos before and after, you can usually see the progress of 2 or 3 treatments and what another 2 or 3 or even 5 or 6 treatments may offer. In some of these best case scenarios, you may only get 50% lightening, but sometimes you may get 80% lightening. I mean, you just don't ever know. I think every patient is unique and every patient deserves a chance. So I think, again, it's not about predicting, but as taking a journey together and setting reasonable expectations.
Thank you. Another patient with a similar story, but it's a different patient. Orhan wants to know, he said his daughter is 6 months old and has a port wine stain on her chest. Is she too young to receive laser treatment?
So I think, again, a lot of my colleagues that are also experts with VBF have made a big case about this, is the earlier the better. And I don't think any of us have ever restricted the age to a laser, even to children who are only a few weeks old, because we all believe that the sooner the better. Infant skin just seems to be much more effective with the laser. There's been less sun exposure, there's less resistance to the laser. And so again, we would start at treating in the first month or two, if not as soon as possible. And it is very safe. We often maybe adjust our settings, to a younger child just to keep it in the more safe range, but it's still very effective. And we know that the children that we start the sooner is the ones that we achieve our best results. And sometimes you get more lasting results, although I think we all know we don't, cure these port wine stains, but we can control them for a long period of time.
Thank you. So Gina writes, she's a 46-year-old woman. She was born with a port wine stain on her cheek of her face. She also has multiple hemangiomas in her liver and also in her vertebrae. She also has cherryangiomas and telangiectasia on her brainstem, and she has Raynaud syndrome. She's not found a doctor that wants to evaluate this. I have had muscle and joint pain and stomach problems since birth. I'm trying to understand how these may all be related. What would you recommend her next step to be?
So for your quality of life, I would recommend getting a good rheumatologist, a specialist in some of the Raynaud's phenomenon, some of your joint problems, some of your vertebral problems, and talk about what the actual issues are. If it's pain management, you may also need to see an anesthesia or neurologist who specializes in chronic pain. And then, of course, you also want to have a birthmark specialist that kind of coordinates a lot of this, because you've described a lot of internal findings as well as an external port wine stain. And as much as it's nice when everything neatly fits together, it sounds like there are just a lot of several issues or medical issues that probably need a coordinated response, but I don't think it's for one doctor only. And so again, I think a good rheumatologist, a good vascular birthmark specialist, and a good pain specialist would be your best approach. And again, each doctor should be able to communicate a clear and effective treatment plan and make sure that each doctor understands what the other doctors are doing.
Would you recommend to, because I'm thinking as I'm listening to you speak and reading what she wrote, that she could get the genetic testing to look for the GNAQ, the PIK3CA, and then maybe have somebody like pull this all together, like Dr. Bly,
Yep.
who works on.
Yeah, exactly, and Dr. Jourley, Dr. Bly are two wonderful specialists on our birthmark.org expert team. And that's exactly right. You do some specimen biopsies, you can look for genetic markers, and there are some exciting medical therapies that we'll probably learn about through the conference speakers this week. And I would absolutely encourage her to do that as well, because again, I say it's always nice when things fit neatly, but it would take a little bit more exploring to see if there's something that again ties it all together.
Thank you. So we have an interesting question from Ligia. Ligia says, thank you for having this Facebook Live. She was born with a RICH, a rapidly involuting congenital hemangioma. She's had 10 plastic surgeries during her lifetime. She still has scars, and she wants to know what you would recommend for the scars. Would you treat this, and does insurance cover it? So
So everything you described is a congenital malformation called a RICH, or rapidly involuting congenital hemangioma, but these often leave behind some form of excess tissue or deformity of the involved skin. 10 surgeries later, it sounds like there's a lot of scar and maybe even some restrictions to that area. And so this is still a reconstructive event, meaning if you still require treatment, this is not cosmetics. And so yes, insurance would cover this. And as far as advice, of course, a picture tells the whole story. So please, email me your photos. I'm happy to offer my advice. Depending upon where you live, I may know some specialists that might be able to help you at this point, and help manage this to get to a better outcome.
Thank you. So Linda writes back again to thank you, and she's talking about her little girl that had the bearded hemangioma and the timing for laser. So she wanted to know, first of all, is there an increased risk, because the baby had ulceration 6 weeks ago, with laser, and she wanted to know if you also do laser.
So yes, I also do laser, and if you are in and around the New York area, I'm happy to examine you through either online, telemedicine, or in person. And I believe your child is 10 months of age, if I recall the question earlier, and that 6 weeks earlier you had your last ulceration, and you've been on propranolol, although for several months. And so I feel that lasers provide safety. And what I mean by that is it reduces the vascular stain of the topical layer of the skin. Now, does laser cause ulcerations? Well, you haven't had laser and you've had ulceration. So what I say is the hemangioma causes ulceration. And when the hemangioma is rapidly growing or still proliferating, it sometimes outgrows its blood supply of the terminal skin. And if you treat with laser and you see ulceration, I think the laser unmasks or exposes the risk of that skin that was outgrowing its blood supply. Because those of us that do a lot of laser know that lasers are very safe. They don't cause damage. They don't cause injury. They block blood vessels. But if there's a at-risk area of skin, and I think some of that skin was going to ulcerate regardless of whether or not we treated it or not, I think that's what's exposed here, is that you are having a simultaneous event, what's called, we call true, and semi-related, which means, and not necessarily unrelated, but doing nothing carries some risk, and you've experienced ulceration, and doing laser will overall treat this condition, but it does carry a small risk of exposing areas that are at risk for ulceration. But the overall nature of the laser is to create a safer and a better integrity to that skin. So with that in mind, I think the risks are very small, but the benefits are very large. And I would encourage you to consider laser. I think most of us who treat this would recommend laser, again, as soon as possible.
Thank you. Simran has a really good question. She says, for port wine stains, should you only get treatments when you're young, or should they continue into adolescence and adulthood?
So great question. And this is what all of us, who are in practice for more than 10 years get to observe, is our little patients become big patients, and our medium patients become older patients. So I have patients I've been following now for 15 years who are now adults and into their lives. And I'll say is the port wine stains are vascular malformations, and vascular malformations we don't cure, but we live with them and we manage them. And so while we have a great effectiveness early in life, and sometimes we control it for many years, it is very likely that port wine stains will continue to progress, and that means darken and need additional treatment for all their life. And I have as many patients who were 15 who are now 25, 35, and 45 at various times had treatments and were able to not have treatments for a period of their life. And then they come back in for a set period of 4 to 6 treatments. I might not see them for another year. We might do 1 or 2 maintenance treatments from time to time. And then they may forget about me for 5 years because they're happy with it for a while, and it creeps back on them over time. And we treat again as we have had before. We just pick up where we left off. So the short answer is it's a lifelong condition. We do much more treatment during growth spurts or adolescent growth when the port wine stains are more likely to darken or progress. We take a break when things are in a stable range and do just maintenance. But yes, it's a condition that you'll continue to treat through adolescence and into adulthood.
Thank you. Debbie Pepish has a good question. She's a 63-year-old woman. She has a port wine birthmark on her upper lip, her eye, and into her scalp. She did several laser treatments with Dr. Nelson years ago. She's never had a seizure or migraines, but she does have glaucoma. Her birthmark has not changed over the years, but she found the website, and after reading about the challenges, she was wondering if she should get an MRI at this point. Also wondering if you could recommend an ophthalmologist that has worked with these like the glaucoma with Sturge-Weber or port wines. I'm not sure where she's from, but on the VBF website, we do have Dr. Kane, who is out of New York, and he's a glaucoma expert for Sturge-Weber. So she could talk to him, but you could also address that.
Let's talk about it briefly. So she's describing a port wine stain that involves the upper eyelid and segment of the forehead. And that's called a V1 distribution, which puts it at risk for having penetration into the meninges of additional vascular malformations inside the brain. And the way you determine this is you do an MRI. And sometimes, a child may not have developed it yet, but it's something that can progress over time. So anytime a child or even adult has a distribution through the eyelid and forehead, you have to be concerned about Sturge-Weber syndrome. Now, any good glaucoma expert has seen patients with port wine stains. And Dr. Kane is wonderful because he may have able to see more patients. And Dr. Ann Comey down in Baltimore is also someone that manages a lot of patients with Sturge-Weber syndrome, which is the syndrome of this collection of symptoms. But the idea is that it also puts the eye at risk for pressure or glaucoma, which will require treatment for lifelong treatment. And I think that a MRI from time to time may be helpful, especially if there's been a change in the clinical situation, to see if something has progressed or grown. Just like port wine stains on the outside can progress over time, they can also progress on the inside. And again, that's an MRI with and without contrast of the brain that will show this area.
Thank you. This is Ligia again. She said that she had talked about having the hemangioma and all the other complications. And she said, when I was a baby, my ear fell off due to my hemangioma. I think maybe she means it was eroded from the hemangioma. So she wants to know what can be done about that.
Yeah, so a very severe ulceration can literally destroy before your very eyes over several weeks a large or aggressive segmental hemangioma, any structure. It could be an ulceration of the lip, of the nose, especially the area underneath the nose, or an ear. And so I don't know how old this person is, but essentially there's a similar, in otolaryngology, we have something called microtia. There are actually children whose outer ear never developed, and so they literally have a stub there, and there's a reconstructive effort for reconstruction of the ear, and you have to go see a microtia specialist. And I work with one in New York, I work with one in Los Angeles. And so if they want to email me any photos, I can give them further advice on this, as well as refer them to a center of excellence for this type of thing. And the short answer is we can actually make a new ear. That's how exciting things are.
Wow, that's really exciting, especially for patients who have had no hope. And one of the questions we get a lot while I'm waiting for some more questions to load, a lot of patients ask me if you accept different insurances, and even if they come from out of state, how does that work?
Yeah, so I'm in 34 insurances, and I'm recognized in almost every state that has a major insurance network. And I accept Medicare, and I accept managed care plans in New York State. The problem is if you have a managed care plan that's limited to your state, you have to get what's called an out-of-network exception or an in-network exception, which means you are allowed to cross state lines and see a specialist if there is no other specialist available in your home state. And so for many complicated cases, that's exactly what we do, is we start a process where your primary doctor assigns you to the local specialist who is not able to treat this. Once that is documented, it's resubmitted to your insurance company. And after a consultation with me, whether it be online or in person, I can write a letter of medical necessity stating that this is something that is not cosmetic, that should be treated. And we basically are able to get what's called an exception to allow you to travel to a specialist. And that's your obligation of your insurance company, is to ensure that you're able to get the proper medical treatment you need by a qualified specialist. And again, unfortunately, sometimes the best plastic surgeon in any given area may not be the best vascular birthmark specialist, nor do they want to be the vascular birthmark specialist for some of these complicated cases. So it's really about coordinating a team of doctors who first can get the right diagnosis, come up with the right treatment plan. Again, I'm happy to help provide that through consultations online. And then we come up with an authorization that, again, if it's going through major insurances, it's usually a 1 or 2 week process. If it has to go through a specialty consideration, it oftentimes goes through an appeal process. But we have 99% of our cases are covered by insurance every year, so it's very few and far in between that we have exceptions. And for the majority of patients, again, 34 insurances covers a lot of bases, but every now and then we do have to go through, extra steps, and we're happy to work with each and every patient individually.
And we at VBF appreciate you so much for that, because so many families try to find an expert and there's none in their state. So they have to go out, and then to try to find somebody that accepts insurance, it's very difficult. So we really appreciate that.
Sure. And also, just for reference, only about half my patients live in New York and New Jersey. The other half travel from other states, and obviously sometimes from other countries. So it's in my practice, it's very routine that we work with patients from out-of-state insurances. It's our obligation to try to do our best to get an authorization. And I have a very experienced team, and I think a lot of our other colleagues in the VBF network also work very hard to get approval for these insurances. The most important thing, I think the VBF has worked extremely hard, is get insurances to recognize. Again, we say this, these are not cosmetic cases. These are congenital malformations. They have required medical treatments. If doing nothing causes progression and worsening, then there's a risk to doing nothing. Those insurances have to treat this and have to permit and cover these medically necessary procedures. So we work as a team. And again, it's all through referral networks to specialists and making sure that each and every patient, whether it be a child or adult, gets the necessary treatment they need and deserve.
Thank you so much. So Simran says, if you have a port wine stain that goes over the eye, should you get an MRI to check for more growth into the brain?
I think one time it should be done at least once to determine if there's anything inside. But often, what's the risk benefit? Well, there's really very little risk to magnetic radiation, with MRIs. But the benefits is you may discover something that you didn't know. And it may also cause you to seek out treatments or evaluations with either an eye specialist or a neurologist or a Sturge Weber specialist that can give you valuable insight to your condition. Because sometimes, you can't judge a book by its cover. Just the vascular stain on the outside does not necessarily determine what's on the inside as well. So I think an MRI would be helpful, and the majority of us who would recommend that at least one time to determine if there's anything intracranial or involving the internal structures.
Great, thank you. So Shudho writes a long email, so I'll read it to you. Hi, Dr. Levitin. Our daughter is turning 5. Thus far, she has received laser treatments while awake. As we are returning after almost a year break due to COVID, we are wondering if now would be the right time to shift to a hospital under anesthesia. With age, she has grown more aware of what is happening around her and is stronger than before, I'm sure. In one of her recent treatments, a part of her eyebrow got burned. Wow. It will probably be more challenging to control her now she is even a year more older. So we're trying to figure out whether general anesthesia would be the way to go, whether the benefit outweighs the risks at this point. Thank you.
So thank you for that phone call. That question. And I'll just I'm going to give a lot of context. I think this is a very important question that we can cover a lot of important bases. So the question is, should my child have anesthesia for their laser treatment? And I'll say it depends. First of all, if you use the child's palm of her hand or their hand, I think anything that's smaller than the patient's palm of their hand can be done safely in the office. But once the area to be treated is larger than the palm of their hand, you got to worry about the risk or concern yourself about the risk and benefits of holding down that child to get that treatment and how long that treatment is going to take and how much discomfort or pain is going to be caused by that treatment. So for a larger area or an older child who is aware, and that can be as early as age 1.5 or 2, or a child that you just can't hold down and now they're moving and you've described, trying to hold a child down and inadvertently lasering an area that damaged an area, especially around the eye, I think you do need to consider anesthesia to calm the child and create a safe environment for that child. Now, the other thing that a lot of patients say, well, what about the risks of anesthesia? Well, we've been doing this for a long time, and we do not treat little children as little adults. We actually have specialty care, specialized anesthesiologists in nursing care. And Dr. Geronimus and Dr. Nelson have actually reviewed the literature so that we can also know that there is no unsafe environment in the operating room with anesthesia, and even repeated anesthetics do not cause any brain changes or any IQ changes that had been suggested early on. And it wasn't that we knew there was. The question was, well, could there be? And when we looked at data from the 1970s and 1980s and compared to the 2000s, Well, we don't even use the same medication, so you really can't compare those two outcomes. But for the last 20 years, and this is where Dr. Nelson, Dr. Hieronymus made a very good push, is we just don't have that. And a lot of us treat enough patients where we have observed this. We've gone back and looked at our patients, those that we've treated for many years. And also, I'm a parent as well of a child that had multiple anesthetics. And I can say that, I treat my patients like I would treat my own family, and I do not have reservations for these short anesthetics for these very safe procedures. Again, risk and reward, extremely small risk, extremely large reward, and the data is in. This is definitely something that we can safely say that it is safe to do. And again, it may be the time to consider moving this treatment into the operating room setting for both comfort and safety.
Thank you. Gina wants to know, can you clarify again what genetic tests should be used in diagnosing vascular anomalies diseases?
Yeah, so there's a whole panel for this now because again, for the last 5 years, it's been a great discovery time for a lot of these syndromes or genetic markers of different types of malformations. Again, things like arteriovenous malformations and venous malformations particularly have shown some very strong genetic markers. But this is something that your regular doctor is not going to be able to do. So you're going to have have these tests sent out to specialized laboratories that actually process these type of things. And Dr. Linda mentioned Dr. Fran Bly, Dr. Beth Drolet. These are two of our wonderful specialists, and we have some West Coast specialists as well that are basically centers of excellence for this type of thing that we refer to. And again, you can find that information on the birthmark.org website as well.
Thank you. Linda writes back again. She's the one with the baby with the bearded hemangioma. She wants to know if she should keep the hemangioma moisturized with either Vaseline or Aquaphor.
Yeah, so Aquaphor is my preferred method. It's very safe. It's a non-steroidal. It's an ointment, so it puts hydration. And basically, you're just trying to prevent drying or crusting around the edges that may predispose or even protect from ulcerations. So yes, for anyone who has hemangioma that's dry or flaky or ulcerated, you can safely use Aquaphor. If there's a direct ulceration, I sometimes switch to bacitracin or neosporin or even mupirocin or Bactroban. These are types of antibiotic impregnated ointments that again help to keep areas clean, avoid the risk of infection, and you should also be able to safely wash this gently with soap and water.
Great, thank you. So we have a little over 15 minutes left. We've been, Dr. Levitin's been answering a lot of questions, and we've got 15 more minutes to answer your questions. We won't leave any of you hanging, definitely. And if he doesn't answer, you can always write to him and he will get back to you. Irina, I think I understand what she's saying. She's saying, do you treat congenital hemangiomas? And if you do, how do you treat them?
So infantile hemangiomas are the most common hemangiomas, which are, again, these things that show up at around birth over the first 6 weeks of life. They have a growth period of 9 to 12 months of age, then they stop growing, then they quote go away, but they go involution, which again, during this time, we may treat with laser, we may treat with oral propranolol or hemangiol, and some of these may even require surgery, especially the ones that occur on the head and neck areas, typically are ones that need treatment. Now, congenital hemangiomas are typically referring to either rich or niche, which are rapidly involuting or non-involuting congenital hemangiomas. And these are, again, less common, more rare, and it's on a case-by-case basis. It really depends upon what the residual tissue is left behind, how it behaves over the first year of life, and whether or not these are things that can be observed or waited on for a little bit longer, or when we can predict that some treatment is necessary. Those of us who intervene typically recommend treatments that start in the first year or second year of life. So again, for every case, these are unique cases. These are individual treatment plans, and that's what we do. So please, reach out to your local birthmark specialist if you have one, or again, you can email me any photos, and I'm happy to give you some advice.
Thank you. And just as a reminder, today is December 9th, because I know this will go on to be viewed many times for many months. But this Saturday, December 12th, in New York City, Dr. Levitin, along with Dr. Hieronymus, Dr. Weiner, Dr. Rosen, Dr. Bly, are part of our vascular anomalies experts team, will be doing a free clinic in New York City. So if you can get to Manhattan, you could get a free consultation. You can still register at birthmark.org/conferences. CONFERENCES, and we will fit you in. We won't turn anyone away. We ask that you bring a COVID test negative, but we will also be doing short COVID testing. So everything is going to be compliant. And if you are in the New York metropolitan area, it'd be probably easier for you to come, especially with COVID. And we do have parking made available for everyone. So Jessica writes, what are your thoughts on treating an extensive venous malformation with sclerotherapy in a 4-year-old child that is not yet causing any symptoms? The VMM is located in his thoracic cavity and by the spine. Is it better to treat early or wait for symptoms?
Yeah, so this is a very difficult case to describe without being able to review the MRI to see where it's located. And intrathoracic implies that it could be wrapped around, important internal structures, arteries, veins, or organs, and around the spine, could potentially be, I don't know what kind of symptoms this is causing. So I think these are type of questions that I would, defer to, a team approach, because it's going to take more than one person to weigh in on this. It's going to take a radiologist, an interventional radiologist to evaluate this, potentially even another type of surgeon if there's something that could be resected safely. But typically we see this as something we would start treating early, because again, left alone, these malformations we know continue to progress, get larger, and they can actually expand and cause compression of some of these very precious, areas, particularly in a small body. Now, for internal structures, sometimes we have to be very careful about what we treat with sclerotherapy to avoid the type of swelling that could potentially compromise airway or some of these, again, compressive areas. So we use bleomycin sometimes as well, but this is what an interventional radiologist would do. And I would say you should certainly look at the Vascular Birthmark Foundation's website, because we have several, world famous experts that can weigh in on this. But again, this is something that needs to be evaluated with the MRI first. It's not something we can just give our opinion over this type of venue.
Thank you very much. So we are still taking questions. We have a lot of people on, so Dr. Levitin is happily taking your questions. And again, he is located in New York City as well as in Los Angeles, although you probably haven't been to Los Angeles, right?
Well, I've been once during the COVID when things had kind of quieted down over the summer. But I've had 2 scheduled visits canceled because of the uptick, because it would require quarantining on travel, coming and going, and it, for 1 or 2 days of treatment, it just didn't make sense. So I apologize to any patients that I've disappointed. We've actually had some of those patients come to New York where it's been, feasible to bring them in for treatment. But me personally, spending 5 days to 7 days quarantining on both ends for 1 day of treatment, my hospital would shoot me. So they said no.
Understood. Hopefully there's light at the end of the tunnel.
We are entering into different times. Let's all keep our fingers crossed and pray.
Have you heard if the FDA did approve the vaccinations in the US? I was waiting any day to hear if it was approved.
Today may be the day for Pfizer, and maybe another day for Moderna, which are the new mRNA virus vaccines are already approved now in the UK, and they've started vaccinating, and just recently approved in Canada. There are 3 other vaccines that are in the pipeline in late stage that will probably be announced in the first quarter of 2021. Some of those are, the new ones that just came out are actually new technology that has never been used before, which is both exciting and also maybe a little nerve-wracking for some people, but they seem to be very effective and very safe. And the other vaccines are protein-based spikes, which are basically traditional ways of delivering vaccines where a protein is introduced to the body, which results in an immune response that teaches the body how to respond to future infections. And I think AstraZeneca is one of those. And again, there's one by Sanofi and another one by a third company. They're just a little bit, behind in the pipeline as far as announcing their late stage clinical trials. But I think we're going to have at least 5 vaccines that will show highly effective, again, more than 50-50, but 80 or 90% effectiveness. There's going to be hundreds of millions of vaccine doses available. So if you're not first in line, you may not, you won't be far behind. I'm very optimistic about what 2021 will hold. And if we can all just wear a mask and hold the line together, we'll make it through.
True. Do you have an opinion about topical timolol for treating a hemangioma? Like, when is it effective and when should you give up and move on to something?
So topical timolol, when it works, is great. And those of us have seen it work, it's almost eye-opening. You're like, really? That's all it takes? But it really works on thin skin. And thin skin is like eyelid skin, sometimes nasal tip skin, sometimes ear skin. But that's really the only time it works, when the hemangioma is relatively flat. As soon as it darkens or thickens, the topical treatment really does not penetrate enough to make a big difference. And sometimes these are part of a larger hemangioma. And so while it's safe to use, it's only effective in a very select group of patients. And one should not wish it well. If it's working, you can continue to use it. But if it's not working, sometimes you need to consider switching to an oral propranolol therapy. And then the other thing that complicates this is timolol is very hard to come by. It's out of stock in a lot of places. It's a specialty pharmacy order that people sometimes have to wait, several weeks to get. It's been sometimes difficult for some of our chain pharmacies to get a hold of, because you need a topical gel, not a solution or liquid. You want the gel formulation. And so 0.5% gel can be a challenge sometimes for supply chains.
Thank you. What's your opinion about a hemangiol versus generic propranolol? A lot of our moms write in that the babies are having diarrhea, reflux, and so forth. Like, what's your experience been?
Yeah, so I mean, I give a lot of credit to the company that created hemangiol, because they actually went through the FDA regulation requirements and got approved for the treatment of infantile hemangiomas. They have also, additional profiles that make it more tolerable. Generic propranolol has a mint flavor, and mint can cause reflux in children, whereas hemangiol does not have mint. Also, generic propranolol comes in 2 concentrations. And so you have to be very careful which concentration is given, and make sure that and when you go for refills, that they didn't change the concentration. And this has happened before, where we've had children that have been dosed on their medication, whereas hemangiol has a single dose. And those of us who treat a lot of patients probably prefer one or the other. I'm in the hemangiol crowd. I tend to have a very easy dosing regimen with that. I have now a 10-year history of using it with them, maybe 8 years, maybe not quite that long. But the point being is, it's a proven and safe and FDA approved profile. When it's not available or not covered, they have a great pharmacy plan, which helps to deliver the treatment to the patients regardless. They want to make sure that each and every child is treated. And I use generic propranolol when it's not available. It's in my backup plan.
Okay, thank you. So what's your opinion about when someone's had like 30 or 40 pulse dye laser treatments for a Port Weinstein, and after the last 4 or 5, the parents or the adult are not seeing any improvement?
Yeah, so this is not an uncommon situation, and I think it's a combination of 2 or 3 things. Number one, those of us who do a lot of laser have our comfort settings. What that means is we all bake cookies, but sometimes at different temperatures. Sometimes our cookies are this big, sometimes our spot size can be bigger or smaller. So sometimes you just need to change that up. And if a doctor has their comfort zone, it's not for me to tell them how they should do it. But me personally, I have 3 comfort zones, which means I have 3 settings that I use. And that may sometimes what I have to change up for a very resistant port wine stain. And sometimes those port wine stains need to be treated at different settings, whether it be a larger or smaller spot size, sometimes a slightly higher setting. But the trick is to make sure that you do it safely without the risk of blistering or scarring. And then second of all, there is a cycling of vessels in a port wine stain. Sometimes you need to take a break for 3 to 6 months and then come back again and see how you do after that. And sometimes that little rest or break can make those same vessels sensitive again. And again, sometimes you just need to change the settings. And I think a lot of us have experience with that to help these patients. So again, if you haven't seen any treatment improvement in the last 3 or 4, change it up.
Thank you. So one of the things we've seen a lot of this year, and it was probably because COVID has been so restrictive with pediatric appointments really being limited to like urgent things.
Early on, sure, yeah.
So we have seen, meaning VBF, a lot of ulcerated hemangiomas that really haven't been treated, and the families have been writing to us and saying, what should we do? So what's your protocol?
So fortunately, I'd say a good portion of my practice has been converted to telemedicine and email. So I'm in constant communication with my patients. In fact, when we don't need them to come in, we usually set up a follow-up telemedicine visit or follow-up email photo, to document how things have changed. So I think it's very important to not drop out of contact with a doctor. It's very important to stay in communication. And again, most of us have converted to offering telemedicine visits, and we can, with a good connection like this, we can kind of see, what's right in front of us. The important thing is not to not get treated. And I think, again, the VBF and I certainly subscribe to, at the 4-week well baby checkup, if there's a growing or or new vascular birthmark, this should be evaluated by a vascular birthmark specialist. And if anything changes, that birthmark should be reevaluated by, again, the same birthmark specialist. So don't go away for 3 months and come back and say, look what happened. As soon as something changes, as soon as you're concerned, I'm concerned, and you need to, represent yourself to show what's going on. But also we reevaluate these, and we might, if we were holding off on treatment, maybe we want to start an oral medication. Maybe we want to start a laser treatment where we were not sure before. And I think if I'm answering your question, I'm saying is stay in contact. If you can't come in safely, find a doctor that can provide an online, specialty visit, whether through telemedicine or email. And you have an enormous number of specialists on the VBF website to choose from.
We have a doctor in our network that you know very well, Dr. David Darrell from the King's Hospital in Virginia, and he uses Honey for treating ulcerated hemangiomas. I've never heard of that.
It's actually Manuka honey.
Oh.
Yeah, so Manuka honey is actually something that has medicinal purposes. People have talked about it for many years as having, can treat allergies, can treat, I won't go into if you Google it, I'm sure people have tried it. But yes, what is Manuka honey? It's a very viscous substance. It probably has some medicinal purposes, but what it really does is it creates a safe barrier on those ulcerations, and it doesn't wash off as well. It's water, it's sugar based, so it can wash off easily with water without leaving a residue like a cream can do. And so I'm sure that's just one of many treatments that we can offer for people who want holistic care or natural remedies and whatnot. I'm pleased to hear that.
Okay, thank you. So we have a long one that'll probably be our last one. It'll probably take you right up to the hour. So Gina writes, have you seen patients that have internal hemangiomas that cause pain? The multiple hemangiomas were discovered years ago during a scan to diagnose pain. Doctors have told me they should not cause pain, and I occasionally receive scans to make sure they are not growing, and there is still no other new diagnosis besides hemangiomas. In your opinion, and I'm not sure where they are internally. Most of the time, I guess we hear of these on the liver, but she's saying they're internal hemangiomas, and she's an adult, and it's in herself. So she's saying,
what can be done?
Yeah.
So again, you're going to need to find a team of specialists, usually a type of general surgeon. Dr. Stephen Fishman is one of our specialists in Boston that has evaluated a lot of these patients. And what I understand is that they use radiofrequency ablation for a lot of these, or some type of embolization if necessary. And you can treat or shrink these areas if they're causing the source of pain. The challenge is you can do a great procedure and do a scan before and after and say, look how wonderful we did. We ablated this area, and it may or may not connect the dots to your pain. So that's the benefits and the risks of doing, elective treatment for these areas, is that it can remove a problem that is visible, but it may or may not connect the dots or treat the underlying feeling of pain or pressure that, may arise. So I would say you would need to find a specialist for an internal, hemangioma or internal vascular malformation that can treat this and do it safely, not over-treat this, not take out the lesion, but damage the surrounding areas. And that's that's the nature or the challenge of birthmark specialists, is how do we treat these areas and leave it basically functional and normal behind.
Yep, thank you. Gina, on the VBF website, we do have Dr. Stephen Fishman's email, and even though he's at the Children's in Boston, he also manages many adults that have visceral or internal vascular anomalies. So You can find him there. If you can't, you can email me at vbfpresident@gmail.com, and I can get you his direct email that you can get in touch with him. So we are at 5 o'clock. Thank you so much, Dr. Levitin. It was a very informative and busy session for our final for 2020. You know, we started out this year saying it was the year of perfect vision, and we tried to keep our focus on the patient, which is all we can really do, is make sure our affected families get the information they need so that they can have a accurate diagnosis and appropriate treatment plan. And we're very excited to have you bringing us to the finish line for 2020, and look forward to next year in California at our regular conference.
Well, thank you for having me. And again, I appreciate everyone who logged on, asked these questions. And those who ask questions, honestly, you're asking questions for other people as well, because these are very common questions that we get. And these, these online forums are wonderful for education, for providing helpful information to people who may not have known what to do. And I encourage everyone who has a birthmark to find a specialist, get an accurate diagnosis, get a treatment plan, and then determine what's best for you. We open doors here. We provide avenues of treatment and options to consider. And I wish everyone a happy, safe, and healthy holiday season.
Yes, and thank you very much. And on behalf of VBF, as we close out our Facebook Live sessions, the VBF Facebook Live for 2020, we also wish you all a happy and safe holiday season. And we will see you in January with Leslie Graff, who will work with me to discuss with all of you the psychosocial implications of living with a vascular anomaly. Stay well. Thank you very much, Dr. Levitin.
Thank you.